All right, it is just past 6 o'clock, so we're going to go ahead and get started. We have a full agenda this evening, and we'd like to just thank everyone for joining us tonight and for the interest in our panel discussion. My name is Pamela Gardner. I'm lead program manager for the Delaware Health Sciences Alliance. Before we get started this evening, I just want to go over a few housekeeping items. The evening is being recorded. The recording will be available for viewing towards the end of the week on the Delaware Health Sciences Alliance YouTube channel, should you wish to replay or share with others. This evening, what we can expect is a panel of experts and moderated discussion will cover a variety of topics, from recommendations for undergraduate studies, preparing for the MCAT exam, what applying to medical school might look like, some recommendations for financial aid and resources that are available to students, the advantages that the DIMER provides to Delawareans for admissions to our partner institutions, and what the journey from medical student to attending physician looks like. We will be taking questions throughout the evening. At any point, please feel free to utilize either the chat function or the Q&A function of Zoom to submit your questions, and we'll pause throughout the evening to take those. It is now my pleasure to introduce Dr. Omar Khan, President and CEO of the Delaware Health Sciences Alliance. Dr. Khan?
Hello, everyone, and good evening. Hopefully you can hear me okay. And Pam, I'll look for a thumbs up from you just to make sure our volume is going okay. Excellent. Thank you, Dr. Levine. So again, thank you everyone for joining us today. The Delaware Health Sciences Alliance is so pleased to partner with the DIMER program to bring to you today's presentation and welcome our terrific panelists. We are thrilled that you all made the time, particularly our audience, to be here today and to learn a little bit about the wonderful advantages that you get for being a Delawarean, and hopefully a lot of families and students and others who are here can hear about those advantages. We're talking today specifically about health sciences education and medical education, and the pathway to medical education, to medical school, eventually to becoming a physician and to coming back to practice in Delaware. The institutions of the Delaware Health Sciences Alliance are all committed to helping you on your journey to do that. And those institutions include Christiana Care, Thomas Jefferson University, Nemours Children's Health, Bay Health, the University of Delaware, the Philadelphia College of Osteopathic Medicine, and the Delaware Academy of Medicine, Delaware Public Health Association. So we are thrilled to welcome you here today. And with that, we'll introduce our panelists here as well. So we are pleased to have with us today our board chair of DIMER, which is our medical education program, which we will hear more about from Sherman Townsend, who is the board chair. Welcome to Kate Smith. Dr. Smith is with the Delaware Academy of Medicine, Delaware Public Health Association. Dr. David Barlow is with the University of Delaware. He's also a board member of DIMER, and he will actually help answer one of the question that was posed to us as well from Anar Modi about how the DIMER program different from Med Scholars. So great to keep those questions coming. Throw them in the chat, and we'll get to them in due course. Dr. Marshall Lee. Dr. Lee is a family physician here at Christiana Care, and she's one of the leaders of the Harrington Trust program, which focuses on community health and community development. We have Dr. Brian Levine, who is the DIO for Christiana Care. He, in that position, he oversees the residency programs at Christiana Care. Before turning it over to Mr. Townsend for a DIMER overview, I just wanted to kind of highlight a little bit about the journey to medical school. And sometimes it's not exactly obvious. Those of us who have been through medical school think, you kind of go through all these steps, which are pretty clear, but it really is not. So after high school, typically we go through a 4-year undergraduate college experience. And at that point, certain science courses have to be taken. And that's the phase of your journey, which Dr. Barlow will tell you a little bit more about. After that undergraduate experience, one applies to medical school, either directly or by taking some time off. And at that point, you get into one of our Dimer schools if you're a Delawarean, and Sherman will explain more about what that program means. After going to medical school, which is 4 years, either at Sidney Kimmel Medical College or the Philadelphia College of Osteopathic Medicine, both in Philadelphia, after that, you apply for what's called a residency before you can practice medicine. And Dr. Brian Levine will talk a little bit more about what that journey looks like. Now, this might sound like a lot of education, but trust me, A, it's worth it, and B, it's learning and enjoyable and practice all at the same time. Medicine is a unique field, and no matter what type of medicine you go into, you will enjoy it because you're ultimately helping to keep our community healthier. So with that, I want to thank all of our panelists, and let's welcome our first panelist here. We'll talk about some of these specifics after Sherman's program. And Sherman Townsend, welcome as board chair of the Delaware Institute for Medical Education and Research, DIMER.
Thank you, Omar. And I want to certainly hand out a very special welcome to, I understand we may have as many as 140 different families involved tonight in this presentation. I want to welcome all of you to listening to our program, and a special thanks to Omar and his team for putting this program together. So I can give you a quick little background. DIMER's been in existence. First of all, DIMER stands for the Delaware Institute for Medical Education and Research. It was originally created in 1969 because Delaware did not and still does not have its own medical school. So there are two medical schools now functioning as Delaware's medical schools. Our relationship with Thomas Jefferson, which is now called Sidney Kimmel, has been in existence now. I believe this is our 52nd year. Will be coming up. Our first class entered in 1970, and the Philadelphia College of Osteopathic Medicine in Philadelphia as well, which is a partnership that we gained about 12 years ago. Overall, there are 30 seats at those two institutions reserved for qualified DIMER students, students from Delaware, of course. And in order to be eligible, you must be a legal resident of Delaware and certainly meet the requirements by Sidney Kimmel and PCOM for admission. And later on, the people on the panel will kind of share that with you, what those requirements are. The key thing is that you're a primary and permanent resident in Delaware. You will be identified when you apply at either one of those institutions as a Delaware resident at that time. And there's an application process with Sidney Kimmel to clarify your residency. And we think probably in the next year or so, we will add that same format to the PCOM application process as well. The key thing here is what DIMER really does for Delaware. If we did not have the DIMER program and you as a student applied from Delaware to either one of our institutions, you would be in a pile with about 10,000 other applicants. And out of those, each of those institutions usually accepts somewhere between 250 to 280 people to each of those classes. So, however, being a Delaware resident and in the DIMER program as an applicant, that pool at those institutions, in any given year, there are usually between 80 or 90 students from Delaware that apply to medical school. So of those, 30 at least or more, and in the last few years, it's actually been more. This past year, we have our largest class, total of 47 students. So it increases your chances, as you can see from this slide. You know, instead of being 1 out of 10,000, you're 1 out of about 90 applicants. And of those 90 applicants, about as many as 50 or 60 of those are offered interviews, and many of them are offered acceptance. Not all of our students come to our programs, but certainly it gives them a huge advantage in getting accepted to start with. So that's the key thing about DIMER. It also provides tremendous networking opportunities, not only with our medical education and healthcare leaders, but certainly with the leadership and our board of directors, many of whom are involved with other institutions in delivery of medical services. Our Dimer alumni physicians, of which there are now more than 1,200 alumni physicians that have gone through the Dimer program. Many of them are practicing in Delaware. And certainly you have, what we like to create when you enter one of our institutions is sort of like a little sorority / fraternity, and all the Dimer students get to know each other, and we try to have special parties and things, dinners to let you get to know each other. COVID has put a little bit of a cramper on that, but hopefully when COVID ends, we'll bring our personal contact back. But the key value is really the mentoring opportunities that are there. So we have unique opportunities for our students. Certainly, you can engage in opportunities to participate in all sorts of different events. There's student research work groups, publication opportunities, and of course, it will be mentioned later in the program, I'm sure, but as a Dimer student, we now have branch campuses. We have a branch campus at Christiana Care where you can do your rotations as a medical student, and certainly the residency programs that are offered at many of our hospitals throughout the state, which would be Christiana, St. Francis, Nemours, and this year for the first time, Bay Health, which is down in Dover and in Milford, with a new campus in Milford. They have 21 residency slots this year for their first ever class. So primarily in primary care, of course, which is our primary need at this moment. So again, welcome to everybody. I hope that after tonight, you'll know a lot more about Dimer. And as to the students, we welcome you. We welcome your questions. Feel free to contact any of us anytime during your process through your education. There is a lot of guidance available to you even through your college days coming forward, making sure you attend the right courses, and certainly get coaching for taking the MCAT examination. And there are lots of programs out there to assist you in that direction as well. So welcome everyone. I'll turn it back over to Omar. Thank you, Omar.
Thank you so much, Sherman. That was a terrific overview of the Dimer program and the Dimer Advantage that's offered to Delawareans. And we'll talk a little bit, speaking of Dimer, about the financial aspects of medical school here. So I'll turn over that to Pam Gardner. And before I do that, I want to mention that Pam, as the lead program manager for the Alliance, has been the driving force behind putting this panel together and most of our educational outreach programs. So this is a huge credit to her and her team for putting this together today. So thank you, Pam, and appreciate your speaking a little bit about this critical aspect of Dimer education, that is financial aid.
Thank you, Dr. Khan, and thank you, Mr. Townsend, for your support in providing the overview on the Dimer Admissions Advantage for our participants this evening. So Mr. Townsend spoke to the admissions advantage that Dimer provides for Delawareans, and going to medical school can seem almost like a dream and an exciting opportunity. Financial aid and student loans can also be overwhelming. And so we're here to tell you tonight, there are many of our panelists who have come before you who have done it themselves. There are multiple avenues it can be done, and we encourage you to really look into resources that are available to you. So we just want to call out a few resources this evening. Both of our medical partner education institutions have financial aid resources available to their student population. Thomas Jefferson, you can see the link here through their main website for the medical school. They provide scholarships and grants, as well as links to federal and state, as well as private loan and grant opportunities. Similarly, PCOM offers the same opportunities and links as well. The Association of American Medical Colleges has a plethora of sources on their website. Again, loan repayment programs, scholarships, grants, other financial aid resources. There is a plethora of information available to you and resources there to assist you with student aid and financial aid as you go forward. Also Delaware has a state loan repayment program, also referred to as SLRP. This student loan repayment program in particular is a partnership between the state and the federal government. There are requirements to work in HPSA areas that are pre-designated and identified by the federal government, but this is another resource. Recently, Dimer's leadership and board and other members of the panel here this evening have been active in advocacy for additional opportunities. Mr. Townsend may want to highlight some of that, formerly known as House Bill 48 that was recently passed through legislature to provide additional student loan repayment options for physicians returning and coming to Delaware. The program has not officially launched yet, but we expect hopefully in the next 12 months that it will. And at this time, I'd love to introduce my colleague, Dr. Kate Smith of the Delaware Academy of Medicine and Delaware Public Health Association, to highlight some resources that they have available for students as well.
Sure, thanks Pam. Thanks for having me. So the Delaware Academy of Medicine, Delaware Public Health Association does have a student financial aid program. You can find it at the link shown on the screen. And our goal is to provide assistance loans to Delaware residents applying studying both medicine and dentistry. It's interest-free during your attendance in school, and repayment will begin 1 year after graduation. These funds are available through a special endowment to the Academy, and they range from anywhere from $4,000 to $10,000 annually. That amount depends on how the people before you have done repaying their loans and how our endowment fund is doing. But everybody gets the same amount that year. It just kind of depends on both of those things. So you do have to be a U.S. citizen and have at least 1 year of residency in Delaware, and you have to be accepted into an approved school as a full-time medicine or dentistry student. And loans have to be requested every year, and the due date is May 15th, and we will let you know by the end of June whether or not you've received a loan. But all of that information is on the Student Financial Aid Program at that link. And then Pam also asked me to highlight something that the Academy does education-wise, and this is not for medical students, but it's for those people who do want to learn more about medicine and maybe don't want to become medical students, don't want to become doctors. Maybe they do want to become doctors and they want to know a little bit more before they get into it. But the Academy puts on something called Mini Medical School every spring. It's a 6-week series of lectures. The lectures are given by healthcare professionals in their field. It's for the past few years, it's been on Thursday evenings. Everybody is welcome. There's no tests, there's no grades. You don't have to, pass an entry exam or anything to get in. But we talk about different illnesses, different trends, up-to-date things. This past year, we talked about behavioral health, we talked about COVID-19, we looked at prostate screening, gene editing, stroke, racism and health. So they are in-depth lectures, but you also get to Q&A with the faculty, who could be anyone from Dr. Lee, myself, Dr. Khan, anybody who we can reel in and get to talk about their favorite topics. We do, and everybody's welcome to come, and that link too is at the top of that screen. So thank you, Pam, for letting me talk.
Thank you for joining us this evening. We will pause here and take questions. Let's see.
So we are open for your questions, of course, and you can type them into the chat box. We have a couple of questions already, and one of the questions we'll actually defer until Dr. Barlow has spoken, and I think the Med Scholars piece will get clarified at that point. One of the questions I've gotten is regarding admission to medical school from Dimer. Does Dimer help get students into all medical schools? And I'll help answer that. As Sherman mentioned, Dimer is an amazing program for Delawareans, and we offer enhanced chances of acceptance into our partner medical schools, which are Thomas Jefferson University and the Philadelphia College of Osteopathic Medicine, PCOM. So those are our two partner medical schools. And the other big benefit of being a Dimer student is if you go to those medical schools, you can come back to one of the branch campuses or clinical campuses for your second 2 years of medical school back to Delaware, and you can come learn medicine here, the craft of medicine in your home state. So it's a big advantage. Dimer does not offer an advantage for other medical schools outside of these two. These are the ones where we have our key partnerships. So I hope that that answered your question. If any other questions, please go ahead and we will take them. Otherwise, we'll give it a couple of seconds and we'll jump into the next panel here. Sherman, anything to add to your presentation before we invite Dr. Barlow?
No, I think that's fine. I mean, I think the key tonight is to try to answer any questions, but our mission is to really make sure that all of our constituents all over Delaware know about this program and the enormous advantage this program gives them to get into either one of those two institutions that we are partnered with. So that's the key. The key is it's so much easier to apply and be admitted to one of our partnering institutions. So, but we're free for any questions, and we hope we'll get a lot of questions maybe at the end of the program, because we really hope we can spark your interest. So thanks for attending.
Thank you, Sherman. We have some good questions as well, and we have one question from one of the high school students here about anesthesiology. What we'll do is the specific questions we'll answer in the chat box as we're talking. And so what we'll do right now is I think go ahead to Dr. Barlow, and Adam, I'll get to your question in the chat box in the meantime. So Dr. David Barlow, I'm pleased to introduce my friend and colleague. He directs the Center for Health and Professional Studies at the University of Delaware. He also heads up their post-baccalaureate program, which he will explain to you. And he is a perfect position to also explain to you the Med Scholars Program. Dr. Barlow, please take it away.
Thank you, Dr. Khan. Our Center for Health Profession Studies has the very simple mission of enhancing student opportunities to matriculate successfully into health profession programs, with the primary emphasis upon medicine and dentistry, but certainly supporting students pursuing all healthcare professions. The nature of our center is such that we support students who participate in majors from all colleges, not just art and science or health sciences, but certainly all colleges. And typically for students pursuing medicine, we probably have about 11 or 12 different majors that are represented in our pre-health profession, pre-med programs. Our center sponsors a medical scholars program, which you've already heard mentioned. It's an early assurance program at the end of the sophomore year with 3 different medical schools, 2 of which are part of the Dimer program, and a program that probably serves since 2008 better than approximately 2/3 of the graduates of that particular program coming from the state of Delaware as Delaware residents. It is a program open to all University of Delaware students, regardless of whether they're in-state or out-of-state, but it does serve the majority of students coming from the state of Delaware. We have 3 affiliations. Certainly, Sidney Kimmel Medical College, that goes back to since 1993. But more recently, since 2018, we've affiliated with 2 osteopathic medical schools. Certainly the Philadelphia College of Osteopathic Medicine, which has 3 campuses, 2 in Georgia, and of course the main campus in Philadelphia. And then with a growing number of students coming from the state of New Jersey, we recently are very pleased to affiliate with the Rowan University School of Osteopathic Medicine. So we provide 3 different opportunities for students to pursue an early assurance acceptance into medical schools coming out of this particular program. The program itself focuses on all of the core science requirements essential for admission into medical school. Plus, it is known for providing a very strong medical humanities and social science foundation to the practice of medicine and other healthcare professions. It is one that we're very proud of, and it's been extremely successful over the years. So if we take a look at the Medical Scholars Program alone, and certainly at the university we have a large number of students who pursue medicine that may not be a part of this program. But since 2008, we have now over 500 students who have completed the Medical Scholars Program, with about 2/3 of them being Delaware residents and affiliating with either the Philadelphia College of Osteopathic Medicine or Sidney Kimmel Medical College. We sponsor through the program a number of medical practica and internships, both domestic and abroad. We have now currently over 400 students who have participated in those programs. We have a group of almost 40 students who will be doing medical practica this coming winter session in the country of Italy. Medical Scholars Program matriculation rate in postgraduate year one upon graduation. It has averaged since 2008, 72%. Our class this past spring, it was over 85% that matriculated into medical schools. By postgraduate year 2 or 3, after graduation, the percentage rises to about 95%. So it's a program that is known for its strong mentoring, advisement, and successful student endeavors pursuing medicine. We have, just again, a mention of some of the different programs that we support. A Health Professions Evaluation Committee. This is a committee that evaluates all of those students, not in the Medical Scholars Program, but who decide perhaps that they wish to pursue medicine as rising juniors or seniors. And they go through a committee evaluation process. The committee itself consists of 18 faculty and healthcare professionals from the community. And this past year, they evaluated the qualifications of a group of students in the senior class and alumni of over 150 individuals pursuing medicine. Approximately 99 of those particular students successfully submitted AMCAS or ACOMAS applications to pursue admission into medical schools. It's a committee that has been in existence far longer than our Medical Scholars Program, and it's known for its strong advisement of students of a realistic nature, assessing their qualifications for pursuing medicine. Our Pre-Health Professions Living Learning Community is a program for first-year students in a living learning community of students who all share one thing in common. They are pursuing healthcare professions. And so in this particular program, the picture in the center shows you Dr. Neil Jasani from Christiana Care, hosting a group of our students a few years ago, who now, if you look carefully at this particular list, you may recognize a few as residents or as physicians practicing medicine in the state of Delaware. This year, we're very proud to have our living learning community since 2015 hosting a group of students in Thomas McCain Hall. And this coming Wednesday, they'll be spending their first evening lab in gross anatomy, being exposed to human cadaver dissection as part of their experiences in the Pre-Health Professions Living Learning community. Our pre-medical post-baccalaureate program is for career changers. It's a smaller program. We limit it to 20 students who are pursuing medicine. These are returning students who definitely did not have, as undergraduate students, the core science requirements or majors in the sciences necessary to pursue medicine, who decided perhaps after they graduated to pursue the field of medicine. If you look carefully at this picture, you'll note that there are a few individuals who are now doing their residencies at Christiana Care Health Services. Since 2015, when this program was created, we've had 100% successful matriculation into medical schools for those students who successfully completed the program with a grade point average of 3.5 or higher. We're very proud of these individuals and the successful rate of matriculation into healthcare professions. Our medical internships abroad are all over the place, from China to Turkey to Istanbul. This happens to be a group of students that were in Budapest at Semmelweis University, one of the second oldest medical schools in all of Europe. And we were hosted by Semmelweis, and our students had a tremendous opportunity to observe and shadow healthcare professionals in a European community environment. Students who have these kind of experiences in our study abroad programs are very unique when they apply for medical schools. And it's so competitive when you apply for medical school that this gives them something that makes them stand out from the rest of the applicants applying for medical school. And we encourage our students to pursue these endeavors wherever possible, if it's feasible during winter session or summer session programs. Other programs have taken place in Athens, have taken place in several different places in Italy, certainly in Spain, Portugal, even the Canary Islands, we had a group of students in. So we look forward to the possibility that future individuals at the University of Delaware will have that similar opportunity. We're very pleased to have a number of affiliations with professional programs and medical institutions. At the top of this particular list, I put Dimer. The heaviest concentration of the successful matriculation of our students in the medical school have definitely been through the Dimer program. We are very proud of all of our affiliations, including even international programs outside the continental limits of the United States. Thank you very much for allowing me to briefly talk with you about our programs. I'm happy to address any questions later on. Certainly, if you look at our center website at sites.udel.edu healthpro, our homepage can lead you to a number of resources that might also address questions about the advisement services and programs that we sponsor. Thank you very much for this opportunity to talk to you today.
Dr. Barlow, thank you so much for providing us this wonderful overview of the programs at the University of Delaware, and indeed available to all Delawareans, both through college and afterwards. We had a couple of questions come to the chat. A couple of them were more specialty specific, and I took care of that. But the broader question, Dr. Barlow, if you wouldn't mind addressing, folks always ask about, what college should I go to be successful in medical school? And I will think about it's not so much what college you go to, but what you do when you're there. So would you mind addressing that a little bit in terms of optimal preparation for a career in medicine? What should one do in college?
Well, you obviously have to excel academically, and you have to excel in the core science courses. I do recommend that students have a strong humanities and social science background with their sciences. But that represents about 25% of the weighted criteria to be admitted into medical schools. Another 25% of the weighted criteria for admission is what you do in your co-curricular activities. Have you shadowed? Have you volunteered? Have you conducted research? Have you studied abroad? What makes you unique as a student applying for medical schools? And medical schools really like to see that kind of breadth in your program of study. The challenge of medical school is one where the rigors and demands of that first few years are so challenging that they want to be able to see a similar demonstration of that ability in your undergraduate preparation. Probably about 50% is then allocated to the preparation for the dreaded MCAT, which is an exam on steroids. It's a marathon mentally. And I understand that we're going to have some detailed information about that in a few minutes, so I won't make any further comments.
Thank you, Dr. Barlow. One other question that came in was actually about the MCAT. Dr. Lee will speak a little bit about the opportunities we have to help. But would you comment just from the Dimer perspective, Dr. Barlow, about what type of MCAT preparation or scores do you tend to look for in our admitted students to our partner medical school? Would you comment on that? Would you like to leave that for Dr. Lee for later?
I could comment now if you wish. The typical profile of a successful student applying through Dimer, they obviously have to demonstrate the academic qualities, the co-curricular qualities, but the MCAT scores, if we take a look at Sidney Kimmel last year, I think the average MCAT score was about 512, the combined subtest total. Typically, though, anything that is above the 50th, 60th percentile, with a strong academic background and a good co-curricular experience, strong letters of recommendation, a positive demonstration of a passion for pursuing medicine is probably just as important, if not more so, than having a really high MCAT score. So I see some students who might not have the MCAT score that some individuals have coming out of very strong preparation programs, but because of the strength of their academic and co-curricular backgrounds, it offset and are successfully matriculated into one of our Dimer programs. The Dimer advantage is really significant. And I hope that the students sitting in today recognize that advantage quite quickly.
Thank you, Dr. Barlow. That's very helpful. So as you heard, folks, the actual numbers of the MCATs, they're important. Obviously, the better you do, the better. But it's really a well-rounded applicant that we seek. Here to give us more of a perspective, now I'd like to bring up my colleague, Dr. Marshall Ali. And Dr. Lee has joined us at Christiana Care several years ago now, and she is particularly interested in community health and community development, and she's a primary care physician by training. She's a fellow family physician, and I'd like to invite her to share some words about her journey to medicine, as well as the work that we're trying to do to help you all improve your chances of getting into medical school as well. Dr. Lee, please go ahead.
Thank you, Dr. Khan, and thank you to all of my colleagues for having me on the panel today. I get very excited about the opportunity to speak to students, and I'm excited for all of your careers. And so, good afternoon, I'm Dr. Marshall Lee. I'm a family medicine physician that had a very unique background in my path to medicine, and now that I'm in medicine. And so I want to provide you with the overview of how I entered medicine and what my career has been like since I entered medicine, as well as tips for you to be the best applicant and excel during medical school. And so I was born and raised in Mississippi. Initially thought that I actually wanted to be a lawyer, but by luck, my first job was through communities and schools at the local hospital, and I worked in medical records. And while there, I was very fascinated about the medical charts. Anytime I had the opportunity to take charts to the doctor's lounge, I would hold conversations with the doctors. Anytime there were opportunities for me to take medical records to the floors with the patients, I would stay as long as possible. Many of you guys probably don't know that medical records didn't used to be on the computer, but they were actually file folders. Yes, folders where they were in like a library of paper charts. And so I was responsible for copying the medical records and making sure that the medical providers had the information about the patients. And so anytime I was copying the records, I would read and try to understand those big words, and thought that it was very fascinating. And so that's where my love for medicine grew. And but I knew that in order to be the best doctor possible, to make the changes that were necessary in my community, that I would also have to build up some additional tools in my tool belt. And so that's where I fell in love with public health and health policy. And so I always wondered, why was Mississippi at the bottom of every good list and at the top of every bad list? And so that's why I knew that I wanted to be the best doctor for my patients, as well as be able to work with policymakers to improve health policy and public health for my community. Following high school, I went to Tougaloo College, which is a small historically Black college in Mississippi. And I was introduced to the field of public health, and I learned how to conduct public health research. But while there, I was a chemistry major and really started building up my pre-med portfolio, taking all of my prerequisites as well as public health courses in addition to that. And the reason why I chose Tougaloo is that they had an early identification program with Brown Medical School. I was concerned about my test taking ability. With the MCAT, I had heard that it was a beast of an exam. So when that opportunity presented itself, I decided to go there. And thankfully, I didn't have to take the MCAT, but many of my friends took the MCAT, and I understood and understand the rigors and the prep necessary to do well on the MCAT. And so following undergraduate, I went to Brown Medical School. Well, not only was I a medicine major, but I also majored in the concentration in advocacy and activism. So I learned how to interact with my patients and policymakers to enact larger system changes. And following medical school, I worked for the federal government for a few years after family medicine residency. And that is what brought me to Christiana Care, where I'm now doing public health research, as well as serving as the doctor at Shoreditch Academy Elementary School in Wilmington. And I also serve on a number of community organizations. You may have seen me recently with COVID. We've been doing a lot of community engagement and working with policymakers to expand access to vaccines to underserved communities, as well as get as many people vaccinated. The joy of my job is mentoring students, and in my current role as the director for the Harrington Community Partnership Fund, we've been able to partner with the Delaware Health Science Alliance to expand our Harrington programs. We have 2 programs that are focused on undergraduate students. One program is the Harrington Translational Research Internship, which is available for gap year opportunities for students from underrepresented backgrounds in medicine to spend a year with us conducting public health research. And I'm very excited about the interns that have come through our program. They're now excelling in medical school. The next program is the Harrington MCAT prep program, which is held in collaboration with Kaplan. It is a 6-week intensive program that has been held for 2 cohorts. Our most recent cohort was this summer, and we were able to support 10 students in that program through the Kaplan program that is completely free. But again, that program is also geared towards students from underrepresented backgrounds in medicine, as well as people who have shown a strong commitment for caring for patients from underrepresented backgrounds. We have not finalized our dates for the new school year, for the upcoming year, but as soon as they are known, we will publicize them to the group. Most likely we will have another cohort in the spring as well as the summer. So I look forward to many of you applying. And so I'm going to provide you with a few other pearls and things that I learned during my journey. And I hope that this is able to enrich your path. My first year of medical school, my eyesight started deteriorating and I became legally blind. What that taught me was the importance of understanding the challenges that many of our patients face and understanding that none of us know the shoes of other people. And so I unfortunately had a lived experience and understood how challenging it was to have a disability. And so I am now more compassionate for my patients and other people who have similar experiences. But it also taught me the importance of you cannot determine what affects you, but you can determine what your response to that was. So I easily could have allowed my disability to overcome me and to be a deterrent and to stop me in medical school, but I actually allowed that to be a stronger driving force for me. I had significant financial strains during medical school that required me to work part-time jobs and even at times take out loans. And so what that has taught me as a doctor now is that I better understand the social determinants of health and the financial strains that many of our patients face. And that has allowed me to be a better doctor. And so those are 2 significant challenges that came in my life. And I want you to know that in your path to medicine, you're going to also face challenges. They may not be similar challenges to my own, but I want you to not be fearful. Do not allow those challenges to deter you from accomplishing your goal, but allow them to increase your skill set and your compassion for other people as you become the doctor that you will become. And so I have a few tips that I want to leave you with. We have already covered a few of them, but I want to encourage you to make sure that you get some medical experience on your resume. I know that COVID has been a big deterrent and has limited the number of clinical experiences that are available. There are still some shadowing opportunities available, some virtual experiences, and just do all that you can. So just reach out to as many hospitals and local doctors to see what is available. Put time in serving others. I know many applicants that did not have the best MCAT score, but have a diverse portfolio of doing research and community service. Those things have outshined their application in comparison to other students. So do as much community service as you can. Consider learning a different language or traveling. That allows you to better understand different cultures. And that is important with being a doctor who is going to be charged for caring for patients from different races and ethnicities. Consider applying to as many schools as possible. Many people don't know that DO and MD schools are very similar. And so I encourage students to apply to both types of school. When it comes to the MCAT, prepare early, prepare early. And this means the summer of your sophomore year, following your sophomore year, that's actually a good time to understand what are these schedules, different schedules, MCAT prep schedules, and what you should do during your junior year. Because towards the end of your junior year, that is when you should be preparing to take the MCAT if you want to attend medical school on time. And so that means that towards the end of your junior year, you should be finishing your pre-med requisites so that you can adequately prepare for the MCAT. And so most ideal it is to take your MCAT during the summer following your junior year so that you can apply the summer following your junior year. If you don't apply for, take the MCAT the summer following your junior year, that means that you probably will be delayed and need to take a gap year. And taking a gap year for medical school is not a bad thing, but I want everyone to be prepared and know what the schedules are so that you can be most informed and make the best decision for yourself. My recommendation, the MCAT requires a very technical expertise. And that is an expertise that you typically don't get from studying for your undergraduate training. And if you're able, I recommend that everyone take a prep course. And if you don't, in some capacity, you may be doing a disservice to yourself. And so I understand that there can be financial challenges, but I recommend that you save up to take a prep course and do your best. Confidence matters. Going into the MCAT, a few of my students are very sometimes discouraged, but I remind them that your self-esteem and confidence are what can make and break you going into the MCAT. And so after you've adequately prepared, studied for a year, you know the content. And so it's your nerves and your confidence that will make or break your score. And so those are my recommendations about preparing for medical school. I look forward to many of you applying for our Harrington MCAT program, as well as our internship. And congratulations. And please feel free to contact me if you have any questions or need additional support. Thank you.
Dr. Lee, thank you so much. Always find your and all of our panelists' comments inspiring and informational, and thank you so much for those. We have a couple of questions for you already. I just wanted to pick up on a couple of themes that you mentioned, especially around the MCAT prep courses. As you can imagine, that will be a question coming up. But you know, the landscape has changed, and I'm so glad that you mentioned this. Back when we were applying to medical school, MCAT prep courses, sure, some people took them, but back then it actually wasn't as much of a recommendation. And I want to again emphasize, it is not a requirement to take an MCAT prep course. You owe it to yourself to do an honest assessment of your own skills, of your own science preparation. Frankly, how strong you were in science in high school, coming into college, how strong you were in sciences in college, and what kind of college preparation you have. For example, you might meet with Dr. Barlow at the University of Delaware, and he might say, we're preparing you for the MCAT through our program. And so you're doing great. You may or may not need to take a course. In some other situations, some other schools, you might in fact want to take that course. So, things are individualized, and I hope you take all this advice in and speak with your mentors and advisors to develop the solution that might be right for you. Dr. Lee, we have a couple of questions coming up here. First question is, would you share some information about available MCAT prep courses? Where would you recommend applicants start by looking at the right MCAT prep courses? And the applicant didn't ask this, but I just want to mention, at what stage do you recommend folks take these courses of their education?
Excellent. Well, the two most highly rated prep courses are Princeton Review and Kaplan. The program that's in partnership with Harrington is Kaplan, and so both of those are highly rated. And I do want to reinforce that I recommend that everyone take a practice test and work with your advisors to determine if a MCAT course is right for you. And so Princeton Review and Kaplan, I recommend both of those. And in regards to when you should take the test, I want to remind you the best time to take the MCAT, I believe, is one, after you've completed your prerequisite courses. So do not take Kaplan. Do not take the MCAT if you haven't finished taking your prerequisite courses. And for most people, they don't finish that until the end of their junior year and the beginning of their senior year. And so the best time, if you're on track, a lot of times is that summer of following your junior year or that late spring of your junior year. But a lot of people also take, so that's when they take the test. And so I recommend taking the prep course at least 3 or 4 months prior to you taking the test. So sometime in the late period of your junior year, going into that early period of your senior year.
Thank you, Dr. Lee. And related to that, the programs offered by your team at the Harrington Trust, when would applications for those be available, or when might you entertain inquiries as to participation?
I'm working with my board now to finalize the schedule for next year, but most likely the application will be available in November, December this year for the spring cohort.
Very good, thank you. So to our audience here, we work in close partnership with Dr. Lee. So when that application is made available, it'll be up on the DHSA website as well. That's www.dhsa.org. It'll also be on the Christiana Cares website for the Harrington Trust. So you'll have many sources. You can also contact any of us, including Ms. Pam Gardner, who will be one of your points of contact. We have a question which I want to throw to Kate Smith, but before we do that, maybe I'll ask Dr. Barlow to comment on the same question we kind of got asked here about MCAT prep courses. David, do you have a perspective on that, and any recommendations you might have? Same question from the panelist.
Well, I would certainly add that the practice exams, the series of exams that the AAMC produces, would be very wisely incorporated into any preparation program. And Dr. Lee's recommendation not to take the MCAT until you've fully completed all of the core science prerequisites that are covered on the MCAT is exceptionally important. We recommend that our students study 2 to 3 months prior to the actual date of the MCAT exam, covering approximately 300 hours of practice exams, usually taken weekly, and study for the either Kaplan or Princeton Review or Blueprint. We also recommend that students might incorporate UWorld Quiz Bank into their program of study as an excellent supplement to Kaplan or to Princeton Review or Next Step. UWorld has produced a quiz bank of about 2,200 questions that are very similar to the questions and format that are found on the MCAT exam itself. And that's been a very inexpensive resource added to, let's say, Kaplan or other means. Typically, a student can pay about about $300 for a 90-day access to the UWorld system of quizzes. But it is really important that the student complete the MCAT, have it placed into their AMCAS or a COMAS application file, so that ideally they can be submitting their applications for medical school by 1 September of the fall semester of their senior year, unless, as Dr. Lee has pointed out, they face the possibility of doing a gap year after they graduate.
Thank you, Dr. Barlow. And we'll take one final question before our next presenter here, and that's for Dr. Kate Smith. Dr. Smith, would you comment or provide a link to where students may be able to look up mini medical school? This is specifically in regards to the question of what could we do at this point to learn more about medicine. This is a question from a freshman in high school. What can we do more to learn medicine? So Kate, if you want to comment on mini med school and any other thoughts that you may have on that.
Yeah, definitely. So if you saw earlier, the slides Ms. Gardner had up earlier had the link to Mini Medical School. I will also put it in the chat. But Mini Medical School is a really great way of just getting an overview of different topics in medicine. It's not going to give you all of them because it's only a 6-week course, but it definitely, oh, thanks. It definitely gives you an idea of some of the topics that might be covered. And having looked at the chat, I think I might float that maybe we should do a topic on anesthesiology coming up because a lot of you seem interested in that. But you know, we do it every year. We're looking into doing it twice a year, and it's all based on what previous attendees have said they might like to see in the future. So all of these things, stroke, gene editing, racism and health, have been suggested as topics from our attendees, and we do our best to get that to you, usually in the next cohort, not in the most recent one. But yeah, I would say come to Mini Medical School, find a doctor to shadow. I had luck asking my family doctor and just saying, hey, can I shadow you for a bit and follow you around and ask you questions while you do it? And they were very happy to do that for me. And I was one of those doctors that took a gap year or, 5. So there are ways you don't just have to go straight through college.
Wonderful. Thank you, Kate. Very good. Well, thank you so much. So we'll move ahead to the next piece of the presentation. And as the presentation comes up, we'll again kind of show you the arc of medical education. As I mentioned before, just to reiterate, by the time you get to be a fully practicing physician, you've gone through a lot of different phases of medical education. You've gone through, ending high school, gone to college, from college on to medical school, and from within medical school, it's really important to recognize that education's actually split up into different pieces as well. There's the basic science part of the education, which is typically the first couple of years. Then the clinical part of the education, the second 2 years of 4-year medical school. People find all of it fun for different ways, but the second half, you really get to do a lot more. You're in the branch campus, Delaware branch campus, for example, whether you're at Christiana Care or Bay Health or Nemours or the VA hospital or elsewhere, you have a really wonderful time interacting with patients. And from that point onwards, once you finish your clinical rotations, then you apply for residency. And that's really when you're a junior doctor, you get to be called doctor, but you're in training. And after 3 to 5 years of training, after that, you typically wind up going into independent practice. So here to talk with us a little bit more about that are several of our expert colleagues from around the state. And it's my privilege to introduce to you 2 of my senior colleagues, I think, who will perhaps speak in turn here. Dr. Brian Levine, who is the Associate Chief Academic Officer for Christiana Care, as well as the designated institutional official, and Dr. Tabassum Salam, who is the Chief Learning Officer for Christiana Care. So I think Dr. Levine is going to lead us off. So Brian, over to you.
Yeah, that's great. Well, thanks so much. And it's a pleasure to be here. Dr. Salam and I are here at Christiana overseeing all the training programs. I also have 2 former Dimer students from the University of Delaware that went to Jefferson. I see Jessica Beadle here, and then Nick Janelli. Both of them are on video and they can tell their stories. So you have the 4 of us with all varied stories. I came from Long Island. I'm struggling to speak slowly now, but I lost my accent about 10 years ago. But we really want to go over some of the sort of the graduate medical education stuff, and I see questions that'll pop up and we'll answer them. But I just wanted to mention a couple of things that were brought up before. I mean, you guys are mostly in high school from what I gather. So, and there may be some I guess guidance counselors, et cetera. But the most important thing is to have a life in high school, enjoy yourself, do activities, get outside, and just concentrate on your grades. I wouldn't go so crazy on trying to get as much preparatory stuff towards medical school until really I enter college. And the college probably doesn't matter that much, but your grade point average does. I interview for several medical schools, and your GPA and that standardized test called the MCAT are very important. So it's important that you do very well in college, at least a 3.5, and do, at least, at the national average on your MCATs. And I think that's important. So grades, college, and then some medical experience. I mean, I don't think you have to right now go run and start volunteering every weekend, but if you can start getting some experience in the hospital setting at the beginning of your college career and enhancing that as you go through, I think that's wonderful. And we want you to do this job because you love it. I love going to the hospital every day. I never say I go to work. I say I'm going to the hospital, and I love taking care of patients, and I think that's really important. So that's my 2 cents before we dive into the slides. But I'd like Dr. Salam to say a couple of words, and then obviously Dr. Beadle and Dr. Genely, since you guys are half my age, you can give your story of how you grew up in Delaware and you went through your process. So Dr. Salam.
I just want to echo what Dr. Levine said. It's a long journey to becoming a doctor, but it's a very fulfilling one. Pace yourself, enjoy every stage, talk to any and everybody you can. As you've heard already from everyone on the panel, no two journeys through medical school to becoming an attending physician, no two journeys are exactly alike. So celebrate your difference, celebrate your strengths, and make sure you're a well-rounded and a well-adjusted applicant with a lot of life experiences, because it's a long journey. You want to enjoy it, and you really want to enjoy the career to come. So I'm going to pause there, and Dr. Levine, take it back, and certainly other panelists.
That's great. So Jessica, if you'd like to introduce yourself and your story.
Sure. Sorry, I was trying to unmute myself there. So I'm originally from Delaware. I am a second-year resident right now in emergency medicine. That's my specialty at Christiana Care. So I know you guys are learning a lot about this process tonight, but residency comes after medical school, and you can choose different specialties to go into. So my specialty would be emergency medicine. I'll be an emergency medicine doctor after residency is done, which is a 3-year program. But anyway, so I grew up in Delaware. I went to the University of Delaware and then applied as a Dimer applicant to Jefferson. In addition to some other schools. I didn't actually do the medical scholars program that was at University of Delaware, but I still ended up at Jefferson anyway through the Dimer program. And then, like I said, now I'm at Christiana, and it's really great. It's a long process, like we said, but it's definitely worth it in the end. And I love what I do every day, and it's such a pleasure taking care of patients. And I hope that you guys kind of get that feeling from all the panelists here tonight.
Thanks, Jessica. That's awesome. Another Delawarean gone good is Nick Genely. Dr. Genely, tell us your story.
Hey, first off, I just wanted to say thank you to the panelists for really having this event for all of our students here on today. So big shout out to you guys. Hey guys, my name's Nick Genely. I am a second-year internal medicine resident at Christiana. Originally from Delaware, grew up in Wilmington. I went to Salesianum, graduated in 2012, went on to University of Delaware and graduated through the Medical Scholars Program, and then went up to Jefferson. While at Jefferson, actually, and just did this as well, we both did our branch campus at Christiana and then stayed on as residents. So she's in internal medicine, she's in emergency medicine, I'm in internal medicine with the career hopes of being a cardiologist. So again, thank you guys for all of your questions, and feel free to shoot them out in the chat.
That's great, Nick. Thanks so much. And these guys have been wonderful. I've followed them since they were students, and they've been part of our branch campus and really represent Christiana, Delaware, Jefferson, University of Delaware really well. So I'm an emergency physician by trade, and you've heard from everyone on our panel about what a branch campus is. So I want to give you a little bit of background and just describe what that process is. Now, this implies that you do as Nick and Jess have done, which is done really well in high school, done really well in college, and got everything set up to go to medical school. And now that once you're in medical school, you have to decide a variety of things. First, I thought medical school was pretty hard, but if you put your head down and do anything, you put your head down and work hard, you really could probably do anything. But we really want to talk about what a branch campus is and how this sort of all came about. Next slide, please. So we just want to give you some background about sort of where we are and where Christiana is. I mean, we're lucky in the way that Christiana is really in the center of a bunch of other states. We don't have a medical school in Delaware, so we're sort of like the only game in town for a large academic medical center. So it allows us to see a lot of patients in sort of a small area and not sort of compete with a variety of other hospitals in like a big city setting. So you think of Delaware as, oh, it's small, it's really, we're in a very lucky position that we are, the only real mega trauma center and teaching hospital between Philadelphia and Baltimore. So we get the chance to really take care of our community, and I think that's wonderful. Next slide, please. And it's wonderful in such that we are big, but we're also really respected for taking great care of patients in our community. There's a lot of awards, and you don't get these awards by paying for them, you work hard. So Pam has got all fired up here. Can you go back one more? Go up one more if you could, forward, sorry. So we are what we call an independent academic center, meaning our medical schools, basically Sidney Kimmel Medical School, where Jess and Nick went, and Philadelphia College of Osteopathic Medicine are both in Philadelphia, but they're 20 miles, 30 miles away from us. We have full control of our residencies, and lucky that we have a lot of medical students and other students that come through Christiana. So Christiana is a several hospital, over 1,000 bed center, and training and learning is really important. If you look, there's a lot of caregivers, thousands, up to 14,000 people work at Christiana, a lot of which are nurses, but a lot are doctors as well as training doctors, which are residents and fellows, almost 300 now. So we're lucky that we get to take care of our community. And I think everyone would agree on the panel that it's an honor to take care of people. And that's really important. And that's sort of what drives us. Next slide. As I mentioned, that we're lucky that we are really, sitting here in such a way that we are the only game in town. So we are really high. If you look, top 20 on the East Coast for patients that we see, deliveries, emergency department visits, and surgery. So another reason why it's great to work in a large center like ours. Next. Like was heard by others or mentioned by others, Delaware is no medical school, only one of 5 states in the whole country that does not have a medical school. So that's actually good in a way and bad in a way. We do have to travel to go to medical school, but it gives us the advantage of Dimer and other opportunities to go to other states to go to medical schools. Next, please. Just a little background about the Christiana campus before we dive into what branch is like. So Christiana is sort of like the mothership. It's the main hospital. It's the center, the center of the northern part of Newcastle County, but it has all the big technology and the wonderful portions of the care in a sort of a suburban setting, the trauma center, simulation lab, etc. Next will be Wilmington Hospital, built even before I was born in 1890. It's about the size of Christiana Hospital, and it's wonderful because you get to take care of this inner city, which is, I think, another important part. You have to learn how to take care of all different types of patients, which is incredible for us. It does have a variety of cool features as well, such as the Joint Replacement Center, a couple of schools, a memory center, community programs, and all the clinics. So it's another wonderful place to work. And most of us work at both Christiana and Wilmington, which I think is really important. Next. Going over Christiana Care as a whole, there are a lot of training programs here, and we're lucky to have these things. And you have an internal medicine resident here, and you have an emergency medicine resident here, but there's also things such as dentistry, radiology, OBGYN, internal medicine, pharmacy, etc. So not all our pure medical. There's other, things as well for allied health style things, which is important too. If medicine, you don't just because people tell you to be a doctor doesn't mean you have to be one. You have to go where you will go enter a field that gives you passion, that you love to, do. And I didn't know what I wanted to do, and I'll open it up to my panel, until I was in my 3rd year of medical school. So I saw in some of the chat people are saying, I want to be OBGYN, or I want to learn how to be an orthopedist. I think now your goal, I think Dr. Salam mentioned it, and I'll probably turn it over to her for 1 second. She said, her one point that I really love is you need to sort of experience as much as you can to see what you like before you start deciding now. And I will tell you, most people, and I'll let Jess and Nick comment on this, think they know what they want to do and have something pegged either from high school or college that said, I want to be orthopedic. That's what I thought I was going to do. And then I realized I didn't want to do it myself. So any comments from the panel, Dr. Salam?
I think you're absolutely right, Dr. Levine. It's great to have a wide variety of experiences. In fact, the medical school curriculum is designed to allow that. It's designed to foster that. As a 3rd year medical student, you will rotate, hence the word rotation, through a variety of different medical specialties. Everyone will, it's mandatory. And it's in that course of learning, you will be immersed with doctors in each of those departments. For example, you will probably partner and learn from someone like Dr. Beadle, who's an emergency department resident when you rotate on emergency medicine. Then you'll move on perhaps to internal medicine, where under the guidance of resident doctors like Dr. Janelli, you will learn about the care of adults in the hospital as well as the outpatient setting. You will then go on to obstetrics and gynecology and learn, again, from resident doctors and attending physicians, who are the senior most doctors, how to take care of women who are pregnant and delivering babies, for example. And you'll go through a series of these different experiences purposefully, so you can experience what it's really like to take care of patients in those settings and at those different stages of their lives. And I think that's a very important time for you to confirm if indeed some of your earlier predictions that you might love orthopedics or anesthesiology are indeed true. You may have changed over time as you've gone through your training to that point, or you may just fall in love with a whole different field. Or you might be like Dr. Levine, without anything definite set in your mind as you enter medical school. But it really does start to take shape, I think, in the 3rd and earliest part of your 4th year. So then you can pick a residency that you're going to apply to and then move on into after you graduate from medical school.
I think that's excellent. Dr. Janelli, what are your thoughts?
I definitely second everything that Dr. Salam was saying. I think that everyone enters the field with an idea, and you really get to know what the day-to-day lifestyle is like when you're on your rotations. So like the panelists were saying before, any opportunity you can to shadow and get into the day-to-day life of physicians is highly recommended. I know that COVID times make it a little bit difficult, but as things start to open up, definitely reach out to any physicians that you know of, any hospital systems, and inquire about what are the shadowing opportunities that are available to me.
And Dr. Beadle, your thoughts?
Yeah, I think, I think that a lot of people coming into medical school don't know what kind of specialty they want to do. I think some people have experiences in the past. Like, for example, I had an experience in the emergency department when I was in undergrad that kind of guided my path. But even just like, obviously in your clinical rotations, you rotate through the different specialties, but even in the 1st and 2nd year of medical school, when you're learning about, say, like the GI system, and you find that super interesting, like maybe you want to do some more shadowing in that area or something like that. So I think there's a lot of different opportunities along the way to kind of find out what you're interested in. And I think if you're interested in something specific, just getting experience and trying to shadow, again, echoing what Dr. Janelli said, I think is good advice for everyone.
Yeah, I think a great important part is you may do shadowing, or get involved in one area of medicine realize it's not what you want to do. And that's important too. It's not only trying to find what you want to do, you really want to sometimes rule things out, because medicine is so broad. You can do so many different things, from radiology to not even really seeing patients in some parts of radiology to surgery. So there's all different types, and I recommend you just keep a real open mind as you go through. Pam, next slide. So as I mentioned, we see a lot of students, which we love, otherwise we wouldn't be at this great teaching hospital, but over 700 medical students rotating through. And I know Drs. Beadle and Janelli rotated through Christiana. And we also do other things, and you guys should consider this, and maybe you won't have a 3.5 or greater grade point average, or you want to try other areas. You should consider things like PA or nurse practitioner have a lot of advantages as well. We have over 200 rotations for PA students. And then look at our nursing students. So don't forget, our nursing colleagues, very valuable part of medicine and for part of the medical team. Over 2,000 nursing students rotate, pharmacy students, and then a variety of other areas of allied health. So there's plenty of different areas of healthcare, and there will be openings in healthcare for a long time. So there's plenty of jobs there if you're ever worried about employment in the future. Next slide. So to mention branch campus, as we go down to our last couple of minutes, and I know I want to ask Dr. Beadle and Dr. Janelli more about this, what that meant to them. But if you look at the pictures, I mean, these are young third-year medical students that have elected to do their entire third year of school at Christiana Care, which is awesome. And I think that's a wonderful. When I was in medical school, I did Summit, my medical school, and Summit, a variety of other different healthcare facilities. So it was a hodgepodge. To be at one campus and to be at Christiana, which is maybe even your home, and to get to know the doctors at Christiana, I think was a huge advantage. Next slide. So if you look at what happened over the past, 10 years or so, the number of students that have gone into the branch campus has almost doubled. We started with 5 to 10 for the first couple of years, and now we're between 20 and 25 a year, which is wonderful. Next slide. And when you look at our third-year rotations, as Dr. Salam mentioned, there's internal medicine, surgery, OBGYN, family medicine. So you get a chance to do everything at Christiana. And with Christiana's size, I mean, we're as big as any major medical center in the country, and we offer just about all the same type of resident experiences, which I think is wonderful. Next, and then fourth year, your last year of medical school is sort of like your chance to dabble and try a variety of different specialties. And Christiana pretty much offers most of them. And if you can't find it at Christiana, there's opportunities obviously down the street at Nemours for pediatrics, or even in Philadelphia if you want to get really niched and find something really, really special. But there's a lot of different opportunities in your fourth year as well. And then, just looking at these things, as were mentioned by Dr. Lean, Dr. Smith, and a variety of others, there are a variety wonderful opportunities just in your backyard at Christiana, which is gives you the opportunity to experience a lot of different parts of medicine, and there's a chance to be mentored and really build a career at Christiana. Next. And then, like I mentioned, that we're going to ask obviously our two residents what their thoughts are. But I, being a part of Branch Campus for 10 years or so, the support and the culture is one where you're really guided towards helping you become the best doctor you can possibly be. Everything is here. We have one hospital, one computer, and it really is just a chance for you to really shine. So Dr. Janelli, what are your thoughts on what were the advantages to you from Branch Campus? How did that make a difference in your career?
Yeah, I definitely thought that the branch campus set a community within a community, because as Jefferson medical students, there's about 200 plus of us. And so during our third and fourth year rotations, we're spread amongst the greater Philadelphia area for our rotations. So we elected basically to do our third year rotations at one system, which had definite advantages, because on certain rotations, for instance, I had rotated on the surgery rotation and just had gone into the internal medicine rotation and said, hey, we need to reach out to this surgeon. Oh, I had just worked with that doctor. I have his cell phone number. Let me just text him the question that the team was asking the surgery team about. And so it kind of had certain advantages when it came to getting to know people around the hospital. And just in general, it was a really, really great experience, and ultimately played into a big part as to why I'm a current resident at Christiana, because I had such a wonderful experience.
That's great to hear. Dr. Beadle, your thoughts?
Yeah, I think that definitely being at one location for a lot of the medical student rotations was a big advantage. I feel like half the time, if you're jumping around from hospital to hospital, you're trying to get used to the new electronic medical record, and you don't really know the system or where anything is. And so you end up spending a lot of your rotation trying to figure out what you need to be doing and not necessarily learning. So I think that it actually enhanced my learning, and that I was comfortable with the environment. So I was able to focus more on the actual patients and the actual information that I was trying to learn on the rotation. And then networking, I think, is really great opportunity. Being at Christiana, obviously now I've stayed for residency, so I was able to meet a lot of people and doctors and other staff my third and fourth year of medical school. And now when I'm consulting other services, kind of like Dr. Janelli said, I am familiar with the people, and they kind of recognize my face, and they trust me a little bit more and my opinions and everything. And so I think that that networking opportunity is really great if you're interested in staying around at Christiana.
That's wonderful. We've come down to our 2-minute warning. I mean, we're very fortunate, and I'll let the rest of our panel sort of do some final thoughts, but you are ahead of the game already by showing your interest here. You have a network of people, as Dr. Beadle mentioned, from early all the way through your career that will assist you. We're here because we love what we do. I mean, we're lucky to have a large community teaching hospital right in your backyard that takes great care of our neighbors. The support here and the continuity and the teamwork is wonderful. So it's something for you to consider. So we expect every one of you who get into a medical school under a Dimer name to consider the branch campus at Christiana, or maybe even other hospitals in the future in Delaware. Last slide, I believe. Oh, we don't need that one. You can go ahead of that one as well. Parting notes from me. Thank you, guys. This is a really great opportunity. We appreciate the chance to do this for you guys. And I'll let the rest of our team say 30-second parting words. Dr. Salam.
I'm glad you're all here. The mere fact that you joined shows your commitment to the whole process and your curiosity. Stay in touch with some of the folks you've seen here on this panel. You're going to have many more questions over the coming months and years. You've started your journey already, and we're all at your disposal to answer questions, offer opinions, and just general guidance. It's always good to have a network that's ever growing.
Thank you. Dr. Beadle.
I just want to thank everyone again for joining us tonight. I think it's really great that you guys are getting involved early on and trying to find out some more information. And, we're certainly happy to share my email if anyone would be interested in reaching out for more questions. But I wish you all the best of luck. And yeah, that's it.
Thank you, Dr. Janelli.
And likewise, best of luck. It is a long journey, but very exciting. So, best of luck for all that. I dropped my email in the chat, so please feel free to reach out at any time.
That's wonderful. I will say we're lucky to be in Delaware, a small state. Everybody knows everybody. Everybody on this panel. I mean, there won't be a time when Dr. Lee will email me a question, or I'll email her, or Dr. Smith, or I mean, we're just really friendly, and we want to help each other. We want to do the right thing, and we appreciate all this. And we're here to answer any questions or anything you guys need. Thanks again.
Wonderful. Thank you all so much, Dr. Beadle, Dr. Janelli, Dr. Levine, Dr. Salam. It's been a joy to continue to work with you. And I just want to emphasize for the students here, no matter what stage you're at, I think Dr. Levine put it really well. We are tremendously lucky. We sometimes take it for granted. Being from a small state is actually a huge advantage for us and for our students. You have a terrific advantage in going to medical school. but much before then, you get an amazing mentorship advantage no matter what you choose to do, whether medical school or not. And all of these folks are here to help you on your journey in health sciences or whatever you choose to do. And they're here as your mentors, which is a wonderful opportunity. I've had the good fortune of, being a Delawarean, and like Dr. Levine, in fact, went to medical school elsewhere in another small state. He and I both went up to Vermont, but, we both found our way here. And we're very pleased that we did that and came back to Delaware. There's really no place like it. And so we would love for you to engage with us, seek those opportunities, to stick around, get some great advice. And I think Dr. Salam put it well. Your specialty choice probably doesn't matter all that much at this point. What matters is you have a commitment to work with people, to improve the art and science of medicine, and to help our communities get healthier. There are 100 ways to do it. I'm a family physician by training. I could frankly just as easily have been an internist. I even thought about trauma surgery at one point, a pediatrician, an obstetrician, gynecologist, several other specialties. So it takes a team these days to keep our community healthy, and you're all part of that team. So I want to thank you for participating, and thank you to our panelists for putting the questions here in our chat box. We will have our we'll have our recording up as well in due course in response to the question. We'll collate the recording, put that up. We typically put that up in YouTube to make it really easy to access. If you want to scan the survey here with your phone, you can fill out the survey, and we'll keep in touch with you as well. I'm going to turn it over to my colleague, the stalwart Pam Gardner, for the last word here. Pam has been terrific in helping put all of our events together. She deserves the lion's share of the credit in doing all of this work. On behalf of the Delaware Health Sciences Alliance and the DIMER program, I want to thank you all for attending today. Pam, over to you.
Thank you, Dr. Khan, and thank you to all of our panelists this evening. Thank you to all of our participants in our virtual audience and for your interest in serving the community and providing healthcare going forward. We hope that you found the evening informative and engaging. Again, we invite you to please provide your feedback via the survey and the QR code. And just want to touch on one final note before we wrap up the evening. A lot of discussion was around the MCAT prep programs. Just want to share that DHSA will continue to provide and update our website with our partner programs, and that just within recent months, DHSA has also launched a DHSA MCAT exam fee scholarship program for Delawareans with demonstrated financial need who have also completed one of our partner MCAT prep programs. So we're excited to continue to offer more opportunities, and our dhsa.org website will continue to be updated with partner opportunities. So thank you again for joining us, and we look forward to having you join us for future events.
I lied about the last word. I did want to say one more quick thing, which is that I hope that the panelists can see that this panel today represents Delaware, but all of you who are in the audience represent the Delaware of the future. And that's what we want to see in healthcare. And I think Sherman Townsend has said this over and over again. We want every qualified Delawarean to be able to go to medical school. And that includes at our DIMER schools, which we have such terrific partnerships. That's what we spend our time doing, making sure those opportunities exist for the next generation. So if you want to go to medical school, we will make it happen for you. If you have the willingness and the aptitude, don't let anything else be a barrier for you. So we are here to help you. And again, I want to thank everyone. And frankly, Sherman Townsend, who's been at the helm of this, he is a non-physician, but an honorary doctor in that regard. He's trained more physicians in his role than most of us have. So I want to thank the DIMER board and those of you on the board, Dr. Levine, Dr. Barlow, Dr. Sherman Townsend, for your service. So thank you very much, everyone. Have a wonderful night, and we will be in touch again soon. Take care.